No more needles. The company behind the popular diabetes and weight loss drugs, Ozempic and Wegovy, finished a successful trial offering the same medication in a pill form. So here with some answers, medical weight loss specialist Dr. Sue Decotiis. Good morning, Dr. Decotiis.
Thanks for having me.
So I bet you're so busy right now. Everyone's asking about these drugs, right? But this is a pill format. What do you prefer?
It really depends on the medication. I think the pill form is great because, as you can imagine, some people have trepidations about taking a needle. Though when people come into my office, we kind of baby them and walk them through it. So most people will be okay with it. Of course, the whole thing also is a lot of the drugs are peptide drugs, and they're not really well absorbed through the stomach. So something like Mounjaro is a peptide drug. So many times that's not going to be absorbed through the stomach, though on occasion we can give it under the tongue in a special format. But it really is an exciting time to practice now because now we have all of these options.
Mm-hmm. What do you prefer when patients come in? Does it just depend on their body fat or if they have diabetes or if they're obese? Which out of all these drugs do you recommend to your patients?
Well, right now, I think I prefer Mounjaro because
Why?
studies have shown that it really beats Ozempic as far as fat loss and control of diabetes. So people can lose up to 22-25% body fat when they use this, which is pretty incredible.
Have you had to see anyone that goes on it and they have a really bad time with it, a hard time with it, and they have to go off of it?
Very rarely do people discontinue because of side effects.
Okay.
So what happens is that after about a month or so, the side effects whittle down. Of course, the appetite is totally suppressed. So I tell my patients, you're going to feel like you've just had Thanksgiving dinner every single day. So they have to be, and that goes away after a couple of months.
So I do know some people that are on it, and they say they just don't feel like eating. They don't feel like drinking. Isn't that anorexia? You're not ingesting any food.
You are. I mean, we give people a very specific diet to follow.
Okay.
And, my patients are here in Manhattan for the most part, and they're pretty sophisticated, so they know how to use the bone broth and soups and things like that. But after a couple of months, you don't have that anorexia feeling. Your appetite is controlled. Okay. And a lot of people find, like if they've been on this for 6 months to a year, that they really start craving healthier foods.
Okay. Dr. Decotiis, thank you so much for coming on with us. It's an interesting conversation. Everyone's talking about this, at least here in New York. All right.